Are you sprinkling chia seeds into your smoothies, yogurts, and oatmeal, believing you're doing your body a world of good? What if I told you that for some, this tiny superfood could actually be a silent saboteur, quietly exacerbating underlying health conditions you might not even be aware of? In this video, we're not just going to scratch the surface. We're diving deep into the intricate relationship between chia seeds and specific health challenges. You'll discover 5 critical health issues where chia seeds, despite their celebrated reputation, might do more harm than good. Our goal is to equip you with authentic, scientifically backed information, empowering you to make informed dietary choices that truly benefit your well-being, rather than unknowingly undermining it. Prepare to have your perceptions challenged and your understanding of this popular seed transformed, all designed to ensure you get the maximum value from every single minute you spend with us. The allure of chia seeds is undeniable. Heralded as a nutritional powerhouse, they boast an impressive profile, rich in omega-3 fatty acids, fiber, protein, and a plethora of micronutrients. For many, they are a staple, a simple way to boost daily nutrient intake. However, the very properties that make chia seeds beneficial for some can, for others, trigger a cascade of undesirable effects. Let's peel back the layers and uncover the specific scenarios where caution, and perhaps even avoidance, is paramount. Our first critical area of concern involves individuals grappling with inflammatory bowel disease, IBD, which encompasses conditions like Crohn's disease and ulcerative colitis. Imagine your digestive tract as a delicate, finely tuned system. In IBD, this system is in a state of chronic inflammation, often characterized by a compromised gut lining and heightened sensitivity. Now, introduce chia seeds. Their remarkable fiber content, particularly insoluble fiber, is often lauded for promoting regularity. But here's the twist. For an inflamed gut, this insoluble fiber can act like sandpaper. Instead of gently nudging things along, it can irritate the already compromised intestinal walls, leading to increased abdominal pain, bloating, gas, and even flare-ups. Think of it this way. You wouldn't vigorously scrub an open wound, would you? Similarly, introducing a high volume of roughage to an inflamed bowel can be counterproductive, amplifying discomfort and potentially worsening the condition. While some individuals with IBD might tolerate very small, well-hydrated amounts during remission, during active flares, chia seeds are often best avoided entirely. The goal in managing IBD is to soothe the gut, not to challenge it further with fibrous load that can aggravate existing inflammation. Moving on, let's talk about the silent struggle many face, diverticulitis. This condition arises when small, bulging pouches, called diverticula, form in the walls of the large intestine. When these pouches become inflamed or infected, it leads to diverticulitis, a painful and potentially serious condition. For years, the conventional wisdom suggested avoiding nuts, seeds, and popcorn for diverticulitis sufferers, fearing that these small particles could get lodged in the diverticula and cause inflammation. While this theory has been largely debunked by recent research, the high fiber content of chia seeds still warrants consideration, albeit from a different angle. During an acute flare of diverticulitis, the digestive system needs rest. Introducing a significant amount of fiber, even beneficial fiber, can increase bulk in the colon, potentially leading to more spasms and pain in an already distressed area. Furthermore, the expansion of chia seeds when hydrated, while beneficial for satiety in healthy individuals, could theoretically create additional pressure within the colon during an inflamed state. While chia seeds might not directly cause diverticulitis, their presence during an active flare could exacerbate symptoms and hinder the healing process. It's crucial to prioritize a low-residue diet during acute episodes to give the colon a chance to recover. Our third health concern targets those with swallowing difficulties or dysphagia. This is where the unique gelling property of chia seeds, usually seen as a benefit, can become a significant hazard. When mixed with liquid, chia seeds absorb many times their weight, forming a thick, gelatinous consistency. For someone with normal swallowing function, this poses no issue. However, for individuals with dysphagia, the thickened, slippery texture of hydrated chia seeds can be incredibly challenging to manage. The gel can become sticky and difficult to clear from the mouth and throat, increasing the risk of aspiration, where food or liquid enters the airway instead of the esophagus. Aspiration can lead to serious complications like pneumonia. Imagine trying to swallow a lump of jelly that doesn't easily break down. For someone with impaired swallowing reflexes or muscle control, this becomes a choking hazard. There have even been documented cases where individuals, unaware of the rapid expansion, consumed dry chia seeds followed by water, leading to the seeds gelling and obstructing the esophagus. For anyone with even mild swallowing difficulties, it is imperative to exercise extreme caution or, ideally, avoid chia seeds altogether. The risk simply outweighs any perceived nutritional benefit. Next on our list are individuals on blood-thinning medications, anticoagulants. This might come as a surprise, given chia seeds' reputation for heart health. However, the omega-3 fatty acids, particularly alpha-linolenic acid, ALA, found abundantly in chia seeds, possess mild anticoagulant properties. While beneficial for promoting healthy blood flow in general, for someone already on prescribed blood thinners like warfarin, Coumadin, this additive effect can be problematic. The concern is a potential for increased risk of bleeding. Think of it like this: your medication is carefully dosed to maintain a specific level of blood thinning. Introducing a food with its own thinning properties, even mild ones, can disrupt this delicate balance, potentially leading to excessive bleeding or bruising. This doesn't mean chia seeds are inherently dangerous, but rather that their interaction with specific medications needs to be carefully monitored. It's not about demonizing the seed, but recognizing the potential for synergistic effects. If you are on blood-thinning medication, it is absolutely crucial to consult your healthcare provider or a registered dietitian before incorporating chia seeds into your diet, or if you already consume them regularly, to discuss potential interactions and monitor your clotting factors closely. Finally, let's turn our attention to individuals with a history of food allergies, particularly to other seeds, e.g., sesame, mustard. While chia seed allergies are relatively rare, they are not unheard of. The proteins in chia seeds can, in some susceptible individuals, trigger an allergic reaction. What's particularly relevant here is the concept of cross-reactivity. If you have a known allergy to other seeds, there's a higher likelihood that your immune system might react similarly to the proteins in chia seeds. Your body, in its attempt to protect itself, might mistakenly identify chia seed proteins as a threat, triggering an allergic response that can range from mild symptoms like hives, itching, and swelling to more severe reactions such as difficulty breathing and anaphylaxis. This isn't about fear-mongering, but rather about informed caution. If you have a history of significant food allergies, especially to other seeds, it's wise to introduce chia seeds very slowly and in small amounts, while being vigilant for any adverse reactions. Better yet, consult an allergist who can perform testing to assess your individual risk before you introduce them into your diet. Your health and safety are paramount. The journey to optimal health is deeply personal, and what nourishes one person might not serve another. We've uncovered the nuances of chia seeds, moving beyond the blanket, superfood label to understand when their powerful properties might inadvertently become a hindrance. Remember, this isn't about eliminating a valuable food source for everyone, but about empowering you with the knowledge to make informed, personalized choices. Your body is unique, and its needs are constantly evolving. Listen to it, understand its signals, and always prioritize scientific understanding over fleeting trends. The information presented here is for educational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional or registered dietitian before making any significant changes to your diet, especially if you have pre-existing health conditions or are taking medications. Your health is your most valuable asset, and a proactive, informed approach is the key to safeguarding it. So, as you step forward, armed with this newfound understanding, remember, true wellness isn't about blindly following the crowd. It's about discerning what genuinely serves your unique health journey. Make choices that resonate with your body's true needs, and you'll cultivate a vibrant, resilient, and truly well-nourished life.